Meaningful use reports. Core measure. Record demographics. Objective. Record all the following demographics: preferred language, gender, race, ethnicity, and date of birth. Measure. More than 50% of all unique patients seen by the EP have demographics recorded as structured data. Unique patients. Unique patients in the reporting period is defined as the number of patient encounters for which the condition exists, where the patient is only counted once toward the measure. Denominator. Number of unique patients seen by the eligible professional during the EHR reporting period. Numerator. Number of patients in the denominator will have all the basic elements of demographics, or a specific exclusion if the patient declined to provide one or more elements, or if the recording an element is contrary to the state law, recorded as structured data in the Patient Management Personal Information section of WRS. Exclusion. There are no exclusions. I'll first run the report before adding a correctly registered patient. Here we see the numerator is 0 and the denominator is 28. Now I will correctly register a patient with all the required fields filled in. Date of birth is a required field. Gender is a required field for this measure. Race is a required field for this measure. Ethnicity is also a required field for this measure. And language preference is a required field for this measure. After completing registration, I will run the report again. Here we see that neither the numerator nor the denominator have increased. The reason is that the measure is associated with a patient encounter, not just the registration process. So I will create a new note to start the encounter. Now I will rerun the report. Now we see the numerator increased by 1 and the denominator increased by 1 to 29.